zao utatoa wapi? Kama 6 zao ilikuwa ngumu.
And that's the cheapest.
Hiyo ni cheapest. Nikasema si nitengeneze kitu moja yenye itafanya ile cost ikuwe ndogo. So hapo ndio nikaland nikatengeneza equipment moja. Ndio kuja straight, check wewe uniambie ama iko straight. Tukiweka against the wall, we have a candle holder.
Mwenyezi Mungu atakufungulia hazina zake nzuri kutoka mbinguni na kubariki kazi za mikono yako. Utayakopesha mataifa mengi, lakini wewe hautakopa. Mungu atakufanya kuwa wa kwanza na sio wa mwisho. Hakika utaendelea mbele na sio kurudi nyuma.
To get blessings za maisha, SEO skiza tune. Dial *811 *928#.
Do you need to send your parcel or document during this period? The Nation Courier Services, with over 15 years of distribution experience, will deliver it for you. We deliver to every corner of Kenya. Due to our strong distribution network, have overnight door-to-door service and same-day intra-city service with the security and safety of the client's shipment guaranteed. Your parcel is our priority. We'll deliver it for you. Contact us for delivery on courierservices@ke.nationmedia.com or call 0719 038 739.
This week on The Trend.
They telling me to stop. Every time we step up on the scene, we make it pop. Yeah, I miss you, Ezzy.
Buy me ama. Oh yeah, can you give me $1? I wanna be your baby mama. With DJ E on the ones and twos.
I can see you looking at me.
All this and more only on The Trend right here on NTV.
At this time, I want to paraphrase another text from the Old Testament, and this is Jeremiah chapter 33 verse 6, and it says that nevertheless I will bring health and healing to it. He was referring to the city of Jerusalem, how it was polluted, how the evils and just crowded the skies and even the streets of Jerusalem, and says, I will heal my people and will let them enjoy abundant peace and security. So God is promising restoration of his people. And I want to give you this hope of restoration, that amidst this coronavirus, God is going to heal his people. Are you infected? Are you affected in one way or another as a family, as I am talking to you today? God has promised that he will heal the land, this city. The cities of the world today are crying of COVID-19, but God is saying he will heal them, and he will heal the people and let them enjoy abundance, peace, and security.
To get One Night Stand by Ibra featuring Harmonize, dial *811 *935#. To get Dodo by Ali Kiba, dial *811 *927#. To get Usinipite by Guardian Angel, dial *811 *932#. Skiza na Nation.
This is the first time in my life I see us crossing. Can you imagine?
The migration, they are here, and there's no tourists because of the COVID.
These 5 cheetahs are known as the tunnel boar of the Maasai Mara, and according to photographers, they're not very easy to spot.
Everybody who lives around the Mara depends on tourism.
For every client entering this facility, they have to be checked their body temperature.
Your priority is for your guests to be happy and observe the rules.
I hope this COVID goes away soon.
This is NTV.
Good evening, and thank you for joining us on the Nation Leadership Forum, whose focus today is in line with the World Breastfeeding Week, which is celebrated every year from the 1st to the 7th of August to encourage breastfeeding and improve the health of babies around the world. Now, this year's theme, Support Breastfeeding for a Healthier Planet, comes at a time when the globe is facing the new coronavirus pandemic, whose first line of defense is a good immune system. Now, it has been proven beyond reasonable doubt that breast milk is actually nature's ultimate vaccine, which gives all children the best possible start in life. So today, I am joined by panelists that will help drive this point home as we unpack the impact of breastfeeding on child development, government interventions, and the role of the private sector in helping to achieve breastfeeding for all mothers. I am your host, Gladys Gashanja, and honored to be joined by a list of eminent panel. And I'll start off with Patrick Courier, who is the Chief of Nutrition at UNICEF Kenya, and Patrick offers technical and financial assistance to the Government of Kenya Line Ministry, that is the Ministry of Health, in charge of nutrition at national and county level, and supporting other lines ministries to enhance nutrition programming. We're also joined by Dr. Mercy Mwangangi, who is the Chief Administrative Secretary at the Ministry of Health. In this case, the Ministry of Health is, among other things, in charge of ensuring implementation of existing legal and policy framework to support breastfeeding in the country. Also joined by Professor Ruth Ndoati, who is the chair of the National Committee on Infant and Young Child Feeding. Now, IYFC is actually responsible for the enforcement of the Breast Milk Substitutes Regulation and Control Act 2012. Professor is also a professor of pediatrics at the School of Medicine, College of Health Sciences at the University of Nairobi, and she's also a renowned pediatrician and epidemiologist. We're also joined by Carol Karuga, who is the CEO of the Kenya Private Sector Alliance, KEPSA. And as you know, KEPSA is the apex body of the private sector in Kenya, galvanizing the private sector through public-private dialogue and influencing the economic and development agenda of a country in Africa. And in this case, she'll be influencing that dialogue around breastfeeding in the workplace. Thank you all for joining us on this very critical conversation and within the World Breastfeeding Week. I'll start off with you, Patrick, and we need to understand right from the get-go, what is really the importance of breastfeeding?
Good evening, ladies, and good evening, colleagues. Well, breastfeeding is very critical for children's development, and we have several data to support this statement. The first one is we can save an enormous amount of life through breastfeeding. It has been demonstrated that up to 800,000 lives can be saved every year through breastfeeding, of which most of these lives are saved in the first 6 months of life of the child, and up to 87% and up to 88% in the first 3 months of life. In addition, breastfeeding contributes to reduce morbidity, so the chances and the severity of a child being sick and therefore being at risk of dying. Breastfeeding is known to contribute to child development, survival, as I said earlier, and overall development, cognitive development of the child. And it's very important that during the first 1,000 days of life, from conception to the first 2 years of life, mothers, the environment, husband, companions are really supporting and understand the benefit of breastfeeding as a pillar of child development, a pillar of child survival, and at the end of the day, a pillar of a strong economy for the country.
Follow-up question as to why it is important to keep on breastfeeding up to 24 months.
The benefit of breastfeeding have been demonstrated from the first hour of life. Basically, as I said earlier, there is a benefit in terms of mortality reduction. From the first hour of life, we can save up to 22% of neonates mortality, and this is an important fact. But as breastfeeding, which is to be exclusive for the first 6 months of life, is continued after 6 months with introduction of complementary feeding, and children continue to be breastfed at 1 year up to 2 years, the gains of breastfeeding in terms of enhanced immunity are sustained. This is why mothers should be supported, encouraged, wherever they are in any conditions, to continue breastfeeding until 2 years of age and beyond if they can.
Okay, now Dr. Mwangangi, the numbers say that globally only 40% of all babies under 6 months of age are exclusively breastfed, and only 45% continue to up to the age of 24 months. What is the situation in Kenya?
So, Gladys, thank you so much for having us here today to discuss breastfeeding. It's a very, very important intervention when it comes to saving the lives of mothers and children. And I must say that it's commendable in Kenya that we are actually doing much better than the global average of 40%, dwindling around 60 to 70% in Kenya. And a lot more can be done to improve these numbers and these figures so that we can ensure that all children are exclusively breastfed, and especially at the beginning, at childbirth, that they are actually initiated within 24 hours onto the mother's breast and initiated on breastfeeding. So Kenya is doing well, and really, you know, the successes of our country are based on our frameworks, our legal framework. You know, our constitution actually guarantees the right to good nutrition, and like you said, breast milk is actually the exclusive vaccine that confers healthy benefits for children. And so that being enshrined in our constitution, the Ministry of Health does regard breast milk as an essential nutrition component. And we've gone further as a country. We've put in place the Breast Milk Substitutes Act that aims to regulate the space when it comes to substitutes for breast milk, and many other strategies and guidelines that aim to improve breastfeeding.
Okay, and Professor Nduati, this year's celebrations intend to shed light on the link between breastfeeding and the environment or climate change. What is the connection here?
Good evening. Thank you for the question. When we don't breastfeed, then we would have to give babies replacement feeds in the name of formula milk. Now, the production of formula milk consumes water. It generates all manner of waste in the environment. So clearly, there's a very clear link that when we breastfeed, we are participating in protecting the environment. We're also ensuring that we have a healthy population.
All right, and according to the latest Kenya National Bureau of Statistics survey shows that the number of women in the workforce actually outnumbers that of men. And others point, Carol, how crucial is the role of the private sector in enabling breastfeeding?
Thank you very much, and good evening, everyone. Let me take you back to where all this began for the private sector. And we have a program that we call the Better Business Practice Children Initiative that began in September 2010 when KEPSA held a women and business leaders meeting to sensitize the on child rights principles during the month of women entrepreneurs, as we used to call it more. We had 28 companies that committed to adhere to child rights business principles, of which BPPC, as we call it, the Better Business Practice for Children, was among them. And among the companies that committed at that time were Safaricom and General Motors, which is now Isuzu in Africa, to mention a few, and Michael Joseph, who was the CEO then, and Mr. Bill Reid, who was the CEO again on the General Motors, Safaricom, led the signing of this commitment, and immediately started to fulfill the commitments of establishing a mother and child spaces in their companies. And then I've had Dr. Mwangangi mention about the breast milk substitute. So what happened at that time, KEPSA collaborated with the AG's office, and that time the AG was Dr. Gutu Guy. And that's the time we looked at the bill and it was taken to the National Assembly, which later became a law in 2012. And this law sought to promote and protect the purity of breast milk. And having done that as a private sector, we figured then we have to start a program, and that's where UNICEF came in, and we partnered with UNICEF from 2012, and we continue to partner today. And the idea is to target and create awareness of the initiative among the private sector and companies, how to start lactation stations, and we already started one as a model. And then we got champions from the private sector, starting with Dr. Mani Chandaria, Architect Lee Karui, Village, Patrick Obath, Rita Kavashe, and ourselves. And we started pushing that to the private sector. And so far we have about 90 companies that have established that. And why do we push why is it important for the private sector, as you asked? And I'll speak in two levels, for the employer and for the employee. For the employer, it improves retention of skills and experience, because it's hard training and it's expensive for each employer to keep training when you lose staff, and especially the women, because they have had to go home and stay with the children. It reduces recruitment costs, lower employees, increased productivity, satisfaction and resilience of the employee, added recruitment incentives for the employer, improve employer image, lowers employers' health and insurance costs, and reduces absenteeism due to improved child and maternal health. And the benefits for the employee, of course, is the improved job security for female employees, retention of skills and experience leading to improved performance, improved productivity, hence satisfaction and self-esteem, improved health of the child and the employee, added recruitment incentives for the female employees, increased spacing between pregnancies, which is good for the mother, better stress management, and decreased risk of diabetes, breast and ovarian cancer. So those are some of the reasons why the private sector has taken this. And not only are we pushing for the companies to do this, we also are working very closely with the Ministry of Health to do the same in government offices. And we've also gone to the lower income places, market areas, starting with Huru market, to start saying, even in the market here, we need to establish this. Because remember, a lot of the people who work there, the women who work there, do not have the capacity to have to be able to go back home or to, and they go with their children to work and all that. So we need playing areas, we need lactation areas for these women.
Okay, and we'll delve further into that in as far as enabling the woman in the workplace. Now back to Patrick, we have talked about the benefits of breastfeeding. Let's look at the cost of not breastfeeding. It touches on health, education, productivity, and of course, generally the economy. How can you kindly tabulate how this affects each of these areas?
Thank you, Gladys, for the question. Very briefly, in terms of the cost of not breastfeeding, I like to go within breastfeeding, but also a bit broader. Last year, in 2019, UNICEF, the Ministry of Health, the Ministry of Treasury as well, and WFP, World Food Program, we've supported a study which is called the Costs of Hunger Study, the Kenya chapter. One of the main findings of the study was basically showing how much Kenya is losing in terms of finances, in terms of resources due to undernutrition. And when we talked about undernutrition in the study, it was very specific to child undernutrition and not maternal undernutrition, another contributor. The study found out that in one single year, Kenya lost 374 billion shillings in 1 year. And this equals to 6.9% of the GDP. This is very, very, very critical information. And this was for only 1 year. You can take these numbers and multiply them over the last 10 years, and you can see how much the country is losing. Why are those numbers important? Is because by missing the point on addressing the determinants and enhancing programs to reduce undernutrition, the country is losing resources. These resources are mainly lost, some of them at the infancy and childhood level, whereby families will spend more resources on healthcare services, but most of it is lost at adult age, when basically undernourished young people become adolescent, become adult, and therefore have less capacity to produce and to contribute to the Kenyan economy. In that sense, malnutrition is not just an issue for young children, for mothers, but it's issue for the whole society. The whole country is paying for the residual but still important malnutrition situation in the counties.
Okay, and you've really emphasized on the heat, on the economy. Professor Ndwati, what is the effect on the development of children when we have to face undernutrition?
Thank you. That's a really important question. The human brain develops in the first 3 years of life. And when you have chronic malnutrition, it manifests itself by impaired brain development. It manifests as poorer performance, lower IQ, poorer performance when you go to school. In adulthood, it manifests itself as lower ability to lower income, lower ability to earn. Longitudinal studies that have followed children who had chronic malnutrition found that for children growing in the same neighborhood and compared to children who are malnourished compared to those who are not malnourished, their earning when they were adults was 20% less. So this is considerable. From the point of view of our country, a very large number of children have chronic malnutrition. In fact, if you look at the demographic health survey data and look at nutritional status of 3-year-olds, 36 months, almost 1 in every 2 children has chronic stunting. You know, they're shorter than they should be. And this is a very good surrogate measure of also what is happening to their intellect. So, but when you breastfeed, the breastfeed does 2 things. First, it provides the nutrition, food. But the process of breastfeeding also increases stimulation to the child. And, increasing stimulation to a young infant actually accelerates brain development. It can actually overcome some level of malnutrition that child is exposed to. So it's critically important to support early infant feeding, the exclusive breastfeeding in the first 6 months, continued breastfeeding until 24 months, and good complementary feeding to meet the child's nutritional requirements.
And speaking on the impact of health or on health, Dr. Mwangangi, there is a stunting classification that was done by the WHO in 2017. And if we can have that map on screen that showed some counties that are on the red when it comes to stunting, with some of them including Samburu, Mandera, Kitui, Kilifi, Narok, West Pokot. Earlier, you touched on the fact that Kenya is doing exceptionally well in achieving breastfeeding for mothers. Then why are we seeing these numbers in as far as stunting is concerned?
Thank you, Gladys. That's a really good question, and really the map that's on the screen is staggering. Close to 14 counties actually have very poor indicators when it comes to stunting. And it's important to note, especially what Prof. Ndwati has said, that there is a direct correlation between the nutrition of a child and their future intellect and their productivity. What we have seen in terms of the counties that are highlighted in red is that there are associations when it comes to food security. There are associations when it comes to climate and in terms of poverty levels, in terms of the mothers being able to actually initiate breastfeeding and continue on breastfeeding for 6 months and beyond. And that's why it becomes so important to note that breastfeeding is not just the very act of feeding a child, but it forms a central part of the Big Four agenda, forming a nexus between the Universal Health Coverage Program and the food security pillar of the UHC agenda. And so what we are doing as government is really focusing on our 14 high-burden counties when it comes to stunting. There are various nutrition programs that are underway, programs that aim to encourage breastfeeding one as a practice. Some good successes have been held in some of these counties, particularly the North Arid counties, where we have peer-to-peer support groups where mothers are actually able to engage with other mothers and support them when it comes to initiating breastfeeding, when it comes to learning how to latch onto a breast, and the safe practices when it comes to breastfeeding. We're also trying to deploy a strategy that will actually have community initiatives. We're calling it a breast-friendly community initiative, whereby we actually go beyond the mother and the child and sensitize the community that surrounds the mother and child so that they can support the mother and child in terms of breastfeeding and can create that environment where it's proper nutrition. It's important to note that breastfeeding in of itself of an act actually requires the mother to also be healthy. It actually also requires the mother to be well fed and to be living a healthy, balanced lifestyle. And so through these two initiatives that we are rolling out, we do intend to see better coverage rates in those counties and an improvement when it comes to stunting levels.
Okay, very well said. And we take a short break on the Nation Leadership Forum, even as we talk about the importance of breastfeeding. When we come back, the WHO and UNICEF are calling on governments to protect and promote women's access to skilled breastfeeding counseling. What exactly is this, and how best can we make it a norm for all? That answer coming your way right after this break. Stay with us.
In Kenya, 1 in 2 children suffer from cavities. Brushing with Pepsodent removes bacteria and repairs tiny holes before they become cavities. Because every smile matters.
Lifebuoy is the world's first to report it sanitizes over 99.9% effective against the COVID-19 coronavirus. Keep using Lifebuoy or any sanitizer with at least 60% alcohol. Stay safe.
I have to admit, I didn't like Sukuma Wiki when I was growing up, but now I've created a way to make Sukuma Wiki tastier and meatier. I simply add 2 Royco beef cubes, and the end result is a rich, meaty flavor. And today, I have brought along my harshest food critics for a taste test. My kids.
More, please!
Royco beef cubes. Add 2 small cubes for a big, meaty taste.
For a better tomorrow, don't forget to do the 1, 2, 3 with Colgate every night.
Pata smartphone mpya kuanzia 20 bob daily pekee ukilipa mdogo mdogo. Weka down payment ya 1000. Lipa kuanzia 20 bob daily kwa miezi 9. Piga star 544 hash kuona kama unafaulu kupata 4G Neon Ray Pro. Si hapo Safaricom ni yako kabisa.
From far with you. I even gifted you a magnificent house. Rosa, it's the thought that counts. Please help me.
When it comes to fever, you need to be both. Panadol Baby and Infant starts to work on fever in 15 minutes and is gentle on the tummy. Panadol Baby and Infant, tough on fever, gentle on your child.
Do your gums hurt? Yeah. Does your toothpaste contain sage, eucalyptus, myrrh, chamomile? All that in one toothpaste? Yes, try Colgate Herbal. Colgate Herbal contains nature's best herbs and Colgate's fluoride technology to give you strong teeth and healthy gums. Ah, Colgate Herbal. Let's go. Colgate Herbal for strong teeth and healthy gums naturally.
Soft lights on set.
Every ounce of energy digging in to give a wider scope of the job at hand.
I love it. I'm in it. See, this is our time. Tukondani. Tukondani.
Toned up faces that display courage in the midst of lights and an always wanting theater with art that reveals the identity.
I am all that you associate me with in the film industry. I am Kenya Film Commission, tasked with ensuring your filmmaking process is a smooth sail. And I can only do it if all you filmmakers are registered with me. Since it is a requirement by law to be registered and certified by the Kenya Film Commission, pamoja tutajenga hii industry and beyond. What's your excuse ya kutokuwa ndani? Je, Uko ndani?
Register today at www.kenyafilmcommission.com.
Ndovu flowers are fortified with vitamins and minerals to provide wholesome goodness for the whole family. Ndovu all-purpose flour makes the most delicious chapatis, mandazis and all other pastries. Ndovu is readily available at your nearest shop. Ndovu Tosha.
When we moved from analog to digital, we took the opportunity to share our talanta. And the rise of local radio represented our voices mtaani. New ICT and educational platforms are going to make sure that no one is left behind.
Communications Authority of Kenya, opening your world.
Thank you for staying with NTV. It is the Nation Leadership Forum, and the focus today is breastfeeding for a healthier planet. I still have my panel with me as we talk about the importance of the same. And I'll start off with Patrick. We have seen that the WHO and UNICEF are calling on governments to protect and promote women's access to skilled breastfeeding counseling. What exactly is this?
Thanks, Letty, for the question. And the point made, statement from the WHO and UNICEF are following. Benefit from breastfeeding, but also that later on from complementary feeding. It is very important to protect breastfeeding from negative interferences from different sides. It's very important to promote breastfeeding so that families, mothers, up-to-be mothers, so pregnant women, adolescents, husband, companions, society are aware of the benefit of breastfeeding, the medical benefits, the economic benefit, but also the cognitive benefit of breastfeeding for child development and survival. Therefore, we are calling on to protect breastfeeding. This is why also, as the cast said earlier, the ministry as a breast milk substitute regulation to promote breastfeeding and to support breastfeeding. Support is very, very critical because that's how we're going to enable mothers to know how to best do it, whether it's in regular circumstances, but also in special circumstances. It's very important.
Okay, Professor.
Protecting and supporting.
Professor Ndwati, a critical component of breastfeeding support, how can this be achieved right from birth?
Well, in fact, we start before birth. As a mother is expecting her baby, this is a time to discuss breastfeeding, the expectations, and that we should start within we actually start the first feed is within half an hour of delivery. This is the guidelines that we have. This suckling of the baby at this point is very important. First of all, it's the baby is born with the instincts to suckle, and the baby then gets the colostrum, which is sort of the big vaccine for the newborn. At the same time, the mechanism of producing milk also helps the mother's uterus to contract and to bleed less, so she's in better health. Now, breastfeeding, although a natural phenomena, is an instinctive one, needs skills. And the practical skills for the mother is how to attach the baby on the breast. The female breast is a very interesting organ, other than being all the other purposes it has. When it comes to feeding, you have a nipple, you have a dark area around the breast called the areola, and then you have the rest of the breast. The nipple is essentially like a gate, so that when you're lactating, you don't go dripping milk everywhere. Now, when the baby is suckling, they need to actually attach on the dark area called the areolae, and that's by attaching there and suckling on there. Then the milk will there'll be a milk let down, and the baby will actually get the feed. Now, that process of attaching is teaching the mother how to do that, how to hold the baby comfortably, to attach on the breast. Actually, it's a critical step to successful breastfeeding. When babies don't attach properly and suck on the nipple, you start getting very painful nipples, and they even may crack. The baby's mouth generates intense pressure, suckling pressure to get the milk. And failure to sort that out, to attach well, and so the mother gets cracked nipples, actually leads to early breastfeeding failure. When you put the baby to the breast, you feel uncomfortable, so you do it less and less. Initially, you may get breasts that are engorged, it is painful, and instinctively you start moving away from breastfeeding to do other things. Breast milk, the breast is also very practical, emits milk according to production, to the demand. So the skill of feeding the baby on demand is important because that's what sustains the flow of breast milk. So lessons like that for the mother are important. Then how do you organize yourself at home so that you can feed your baby on demand? How to take care of yourself, how to not feel guilty that you're not doing the other tasks, that you actually focus on this little baby who needs to be fed on demand, actually every 2.5 to 3 hours. Breast milk is digested in that period of time, and like replacement feeds, which take a little longer. You also need to provide mother with the skills to understand her own body. Many times mothers feel they don't have enough milk because of how they feel, reassurance, support. So there's quite a bit, but very important for successful lactation, yeah.
Okay, and Dr. Mwangangi, clearly these are skills that are needed for every woman in this country. Do we have sensitization on the same that is actually pushed by the government and by extension the county government?
And I like what Prof. Duarte said, that you actually have to start before delivery. And so what we've done as government is we've rolled out an initiative that is known as a baby-friendly hospital initiative. And we do advise most mothers, as they consider one of the facilities for delivery, they should find out, is this a baby-friendly hospital? And what it means to have a baby-friendly hospital is that you would be able to get the counseling services that you require prior to delivery. So during your antenatal clinics, you'd be able to go through the process of how to latch on a baby onto the nipple, how to be able to maintain hygiene and sanitation, the frequencies, and all the issues that Prof. Duarte has mentioned. Additionally, then, you'd then be taken through what we call postnatal care. So after delivery, the hospital is expected to initiate breastfeeding, principally immediately after birth, within 24 hours, and promotions such as issues like kangaroo mother care, where the baby is actually latched onto the chest of the mother, would happen. There'd be proper facilities and a nurse who's able to guide you through that process, give you the reassurances for mothers who may be anxious when it comes to the level of milk that they're producing. So we actually have an initiative known as a baby-friendly hospital initiative. And if you go to a hospital as a Kenyan mother and woman, you need to find out, is this a baby-friendly hospital?
Carol, you said the private sector is playing its part in enabling women to breastfeed in the workplace. Are you always looking out to ensure that you cater for the wellness of all women and ensure they have the right skills?
Yes. So there's a program, as I said, the program runs at KEPSA Foundation, and we have a champion called Gloria Ndeke, who is a KEPSA trustee. And so what happens is that she's able to come up with not only booklets, we're able to do radio, like this time of COVID. We've been doing some radio shows and all that and talking about it, talking about this whole best practices for children, the breastfeeding week and what it entails, and also having sessions with for private sector. So she's been handling that and working very closely with UNICEF. And of course, the business members of KEPSA, with the associations and the companies. So that it has to continue. I think it's not something that you can do once, but it's something that you have to continue doing on a regular basis. And so we target. So we've done banks, we've done manufacturing, And we're looking at the different sectors, and we have 14 sectors of the economy. And so we're targeting one sector after another, and also going from not only the big companies, but also the small companies, and also like talking to the small companies and telling them, if you don't have enough space, you don't have to think that I can't have a lactation area. I don't understand what to do with my employees who are breastfeeding. We look at it, just come together as a building and say, we will take one place in the building that we will set up of all our offices, and this will be the place where all the women can do this, but also the materials are circulated and all that. So we just look at different models on what can work for business depending on where businesses are. And yes, it's a continuous enhancement program, and we look forward to always the yearly breastfeeding week, so that we can enhance and keep the awareness going, that it continues the whole year.
Patrick, we have said that the globe and, of course, Kenya have made great strides in achieving breastfeeding for all mothers, but we still have a long way to go. What are some of the factors that continue to impede achieving breastfeeding for all mothers? Patrick,
Gladys?
Can you hear me?
Yes. Yes, I can hear you now. Thanks. Sorry, so in terms of the challenges to breastfeed, first of all, to exclusively breastfeed, I mean, as said earlier, there's some aspect we need to start promoting breastfeeding early enough. Promotion of breastfeeding and decision to breastfeed should be made before the delivery of the child. Therefore, early initiation can start in the first 30 minutes. Other challenges includes, beside knowledge, maternal workload. As Professor Ndwati said earlier, some mothers will feel some discomfort in terms of the time they need to allocate to the different children in a household versus the newborn. But maternal workload is also a criteria that can affect the initiation of breastfeeding, the continuation, and sustaining it through the second year of life of the child. In addition to lack of exposure or inadequate support to do breastfeeding the way it has to be done, whether on regular circumstances or in special circumstances.
Professor Ndwati, you touched on availability and marketing of breast milk substitutes being one of the factors that impede exclusive breastfeeding. Speak on the same.
Yes. The infant feeding code and what now we have as our breast milk substitute act was triggered from a time maybe 30 years ago when infant formula companies were aggressively marketing breast milk formula to mothers and presenting it as better than mother's milk. This goes on even to this day, but in a much more subtle way. And the presentation of formula as an easy alternative, as a desirable alternative, or even the packaging of formula and giving the impression that mother's milk is not good enough, undermines women's self-confidence. Our world, women are often treated as second-class citizens, not so much by the government, but within their communities. You then have anthropologists have found that when you have this baby, this very precious gift of a child, many women doubt their ability to feed their baby successfully. Mm-hmm. They've had this constant message of that you're not quite there. So now when this very precious gift, it's that self-doubt is further increased when you then bring other products that are presented wrongfully that they are better than mother's milk. So there are those kind of influences. When well-to-do women or well-educated women are busy formula feeding, bottle feeding, they also drive the fashion. They drive the standards, and they greatly undermine actually breastfeeding in a nation, in a country, because other women want to emulate them because they have all the trimmings of success. I think the greatest advances that we have made is that the understanding of the science of breastfeeding, what breast milk, the value of breastfeeding, and the adoption of this, not just by poor women by default because you can't feed your baby with anything else, but the much more deliberate choice that I am going to breastfeed. I think also the other, just to add, is the government, the Ministry of Health, has tried very hard to work at the challenges that actually take away from breastfeeding. And HIV infection and mother-child transmission of HIV was one of the greatest challenges we faced in the past 30 years. Today, we have excellent programs that offer every pregnant woman the opportunity to know their HIV status. If they're HIV infected, we provide them with treatment, really good medicine that suppresses their virus and completely diminishes the risk of transmission to their infant. So, and what this has meant is that now we have a one message. We breastfeed our babies up to 24 months. And that way we have moved away from the programs and policies that really increase stigma around infant feeding.
Let me bring in Dr. Mwangangi on this one. There are circumstances that actually call for a mother to use substitutes. Which are these crucial and special circumstances?
So it's interesting because that question requires really clear clarity for all mothers to understand that at the end of the day, the Ministry of Health and government, UNICEF, WHO do advocate for exclusive breastfeeding. But there may be circumstances, and really these can be grouped into, different areas in terms of work, in terms of, nature of employment, that may mean that a mother may perhaps breastfeed for 3 months and then have to, drop off and, then would require substitutes. There are a few conditions, but very fine between that would require a mother to perhaps cease breastfeeding. And I'm happy that Professor Ndwati has been able to explain that as it stands in Kenya today, even HIV positive mothers are able to exclusively breastfeed because of reduced risk of transmission. And what is important to point out right now is that even today, in the age of COVID-19, several studies have been done, and these studies show us that it is safe for mothers to continue breastfeeding even when they are positive, even when they are COVID-19 positive. And what they can do in terms of precautions is to ensure that they maintain hand hygiene, hand washing, and that they put on a mask while they're breastfeeding their child. And that the benefits of breastfeeding far outweigh the benefits of ceasing that when a mother is COVID positive.
Now, Dr. Mwangangi, there's a question here from George who asks, what happens for that list that you just gave of the special mothers who can actually use substitute milk if they cannot afford it? Apparently, they are too expensive. So what happens in this case, and how can the government alleviate the same?
Great. So what we're doing is Kenya is one of the frontier countries who has launched what is known as a human breast milk bank. And this is an initiative that we're very proud of. It is under pilot stage, happening at Pumwani Hospital in collaboration with different partners, such as UNICEF and PATH. And what we're doing here is that we're having mothers who are lactating donating any extra breast milk that they may have. And this has been determined to be the second best alternative when it comes to breast milk. Now, Prof. Ndwati, who's present here today, was once a lecturer of mine in pediatrics, and will go on to tell you that other substitutes when it comes to cow milk, goat milk, all have effects when it comes to the gastroenterology health of a baby's gut, because a child, as they develop, is very sensitive when it comes to exposing them to other forms of milk. And there are preparations, particularly for mothers who may have challenges, that would then be prepared through guided, skilled clinician setting, whereby a mother can be sort of given instructions how to dilute different forms of milk, so cow milk and goat milk. I've been told, and perhaps Prof. Ndwati will remind us here, if goat milk sometimes is better than cow milk as a substitute, and particularly would require to be diluted to make it better for the baby's gut.
Professor Ndwati, before we take a short break, a quick comment from you in as far as wet nursing is concerned. A wet nurse is a woman who breastfeeds and cares for another's child. Is this encouraged, and what are the possible risks?
Thank you for the question, but let me start with the previous question. There was a time we used to dilute cow's milk and goat milk and all that. We don't do that anymore. it's just too harmful to the newborn. And we used to do that because we had no medicine for HIV. And today we have great medicines for HIV. A baby breastfeeds the mother's milk. Now, you had asked, please repeat your question.
The question was, do we still advocate wet nursing?
Okay, good. Now, wet nursing we do not advocate wet nursing.
Why?
Wet nursing was a great plan for feeding the infant, but HIV is a problem. Mothers who are wet nursing other people's babies are capable of transmitting that virus to the baby, and for that reason, wet nursing fell off the radar screen as a way of providing alternative milk. However, expressed breast milk from a mother who has gone through a process of screening to establish that she's healthy, and her milk going through a process of pasteurization, which is what the Human Milk Bank does, continues, and it is actually a common practice in many parts of the world. But wet nursing, as we knew it in the past, is discouraged. We did some interesting work in the coast in the early, maybe 10, 20 years ago, and found that communities also have reservations about wet nursing. They want to be the ones to decide who would do wet nursing. They're afraid that the baby's spirit will be stolen away by the wet nurse, you know. As a public health program, we don't promote wet nursing, but we do know that it does still continue within families, especially when you've lost a mother at childbirth.
Patrick, there is a Millicent who is asking on Twitter that it is imperative that we remember that all women, despite their ability, should be involved in this. So as we speak about skilled counseling, do we factor in the special needs parents?
Yes, thanks, Gladys. In terms of special needs, the current guidelines that are in place in Kenya are basically made in a way that they support healthcare workers and also community health volunteers to provide the technical support, and they've been trained for that for all children, regardless of the needs or the special needs. So these guidelines and these skills they have enable them to provide assistance support to all children.
Thank you for that, Patrick. We take another short break on the Nation Leadership Forum. When we come back, we talk about some of the stigma and misconceptions around breastfeeding that need to be busted, and of course, what you as a mother can do to ensure that you give your child that first line of life, which is breastfeeding right from birth. Stay with us.
Various institutions have reported over 800 million units of unclaimed shares among other assets. To find out if you are an owner or beneficiary, dial *361# or visit www.ufaa.go.ke.
The Aerial Guarantee.
Asante sana. Sasa, ni nini kingine ambacho unaweza ukamfanyia msichana wetu?
Kila kitu. Hata kufua nguo na aerial mpya.
Basi, tuonyeshe.
Hey, sasa fanya haya madoa yawe sugu zaidi. Sasa tufue kwa kutumia sabuni yako na kutumia aerial mpya. Aerial sasa inapatikana kwenye pakiti mpya. Unaniamini sasa?
Aerial huondoa madoa sugu kwa mwosho mmoja. Ijaribu leo uamini.
Breaking news from Molfix. Let's see what they're developing right now.
Molfix pants with anatomic fit technology. New Molfix pants, an invention from babies for babies.
You should also try Molfix.
You in the pollution. Yes, you. Dry throat? Strepsils. Gal in the smoke with a raspy voice. Strepsils. Hello, in the downpour with a scratchy throat? Take Strepsils. Get soothing relief for any throat irritation. Strepsils with its medicinal ingredients will heal the harm down to your throat from external factors. Strepsils. Strepsils for a dry, itchy, raspy, scratchy throat.
Did you know that Downy Concentrate softens impressions 2.5 more clothes per litre than the leading fabric softener? It's more concentrated, so use only 1/3 of a cap.
Ah, Helen Paul. Hello, madam. Would you like to join us on this mission? Yes, but how? Just one question for you. How do you keep your toilet clean? I use regular detergent and bleach for washing and removing yellow stains. I've been using it for years. Oh, madam, the regular detergents and bleach are used for washing clothes. To disinfect your toilet properly, you need Harpic 10X. It is specially made for germs and stains removal. Harpic's thick formula settles on stains and gives 10 times better cleaning compared to regular detergents and bleach. Wow, now I'm convinced, Helen Paul. Really? Yeah. Now that she's part of the mission, the next house is yours.
Get this and more Christian music only on Angaza Music. Get Angaza Music for 10 shillings daily plus 50 MB data bundle. Dial *544#, then select option 6 on your Safaricom line. Angaza Music, Baraka Mkononi.
This week on The Trend,
Vile shorty yako box, they telling me to stop. Every time we step up on the scene, we make it pop. Yeah, I miss you, Ezzy.
Buy me ama, oh yeah, can you give me $1? I wanna be your baby mama.
with DJ E on the ones and twos.
I can see you looking at me.
All this and more only on The Trend right here on NTV.
This is NTV.
Tonight, MPs approve huge payout for retired colleagues, but it's weighing heavily on an already strained budget.
That obviously has to be drawn from the taxpayer. Can we afford as a country to increase benefit to that level?
Wamesave kupitia kwa CDF, kupitia kwa pesa kadhaa, marupurupu, wako na mali.
Also tonight, public transport vehicles throw safety out of the window, despite an uptick of coronavirus infections.
It's no longer monkey business or mouse and cat business.
Plus,
hofu yangu kwa nikiwa hii muda mrefu naogopa kuolewa mapema.
How the sun is keeping young children in the torrid villages of Garbatula catch up with schoolwork. And also tonight, where's the cat at? Keeping track of the lion movements in the Mara to save them from extinction.
Lions are endangered. We have 2,489 lions in the country.
Get free access to digital learning today. For primary and secondary students, one can now access learning and revision materials that has been approved by KICD. Dial *291# and subscribe to Safaricom Digital Learning and Shupavu 291 today. Tufungue njia, elimu iendelee.
Geisha aloe vera and honey, made with the goodness of aloe vera to calm and refresh your skin.
Be strong and last long.
There's no debate. Home is best. If you must pay for deliveries, use your NCBA debit card. Stay home. Stay safe.
I have to admit, I didn't like Sukuma Wiki when I was growing up, but now I've created a way to make Sukuma Wiki tastier and meatier. I simply add 2 Royco beef cubes, and the end result is a rich, meaty flavor. And today, I have brought along my harshest food critics for a taste test. My kids.
More, please.
Royco beef cubes. Add 2 small cubes for a big, meaty taste.
Breaking news from Molfix. Let's see what they're developing right now.
Invention from Molfix just for your baby. Molfix pants with anatomic fit technology. New Molfix pants, an invention from babies for babies.
You should also try Molfix.
In Kenya, 1 in 2 children suffer from cavities. Brushing with Pepsodent removes bacteria and repairs tiny holes before they become cavities. Because every smile matters.
How powerful is the healing power of Vaseline? We applied Vaseline jelly to one leaf, the other we left alone. After just a few days, the difference is visible. Nothing locks in moisture better to keep skin restored. That's the healing power of Vaseline.
When we moved from analog to digital, we took the opportunity to share our talanta. And the rise of local radio represented our voices mtaani. New ICT and educational platforms are going to make sure that no one is left behind.
Communications Authority of Kenya, opening your world.
Thank you for staying with us. It is the Nation Leadership Forum. My name is Gladys Gashanja, and we still have our panelists with us, even as we talk about the importance of breastfeeding for a healthier planet. And at this point, the importance of busting the myths and misconceptions around breastfeeding is very crucial. Professor Ndwati, we have many who talk about how endowed a woman can be, has a way or influence in how much milk she can produce, or if she should breastfeed at all. What are some of these myths that you come across?
Thank you for that question. Yes, women are concerned about the size of their breast and whether it will make enough milk. I want to reassure you, even the smallest of breasts is capable of making enough milk for the baby, as long as you breastfeed on demand as the baby requires. A normal healthy woman will make about 1.5 liters of milk per day. That's actually an increase in the income of the family, because if she wasn't breastfeeding, you need to buy that milk. Even when a mother doesn't have enough to eat and is malnourished, she will still provide breast milk to her baby. The volumes decrease, but the fat content in the breast milk increases, so that the baby still gets enough energy and protein and their requirements as they grow. So your breast size does not affect how much breast milk you make, and also hunger, even extreme hunger. The physiology of our bodies is that we still conserve the future. We conserve the future. Mm-hmm. So we continue to make breast milk even when things are really hard.
Okay.
Other worries women have is about the breasts are going to fall. You're going to stop looking like a nice young girl. I would like to assure young women and older women that with age, the elastic fibers that hold your breast up so that they look good will wear down, and eventually they will look down to your toes. But the good thing is that we have technology, a good underwear, a good brassiere, and I would say one with the white straps that gives you good support, will help sustain your figure, your figure is the beauty of your body. The other thing is that during pregnancy, you gain weight. And this weight is a storage of energy for when you're going to be breastfeeding. Mm-hmm. So if you breastfeed, you will lose that fat, and you will return to having really a lovely body shape. But if you do not breastfeed, and especially exclusively breastfeed, that residue fat is left, and you quickly start losing that beautiful figure of 8 that we all enjoy having when we are young, a young woman and having a young baby. I would also like to add that breastfeeding stimulates your body to make hormones that make you feel good, that make you look attractive. So you're being attractive to your baby and to whoever is your partner. It's a good time. It's a good time you're in an optimal state for nurturing the life, nurturing the next generation. And I think as young women, you should enjoy it and do it with, enjoy it, know it as a season that will move on. How well you breastfeed, how well you bond with your baby determines the character of that person. A baby who's breastfed on demand, their needs are met on demand, grows up to be a confident person who knows that the world is a kind place, who is likely to be the fine young man or the fine young woman who you look at and say, yes, this is my daughter, this is my son, I've done a good job. It all starts in those early days, yes.
Okay, now good things all around for both mother and child, but we also know that culture and religion influence breastfeeding behaviors and practices across the world. Patrick, what is your experience in as far as the influence of culture and religion?
Thanks, Gladys, for the question, and thanks, Professor Ndwati, for these very powerful messages. In terms of culture and influence on breastfeeding, we know that there are different myths and misconceptions around breastfeeding. They've been documented through surveys, studies globally, but also in Kenya. And we know about those ones. And to be very clear, as messages, as support to mothers, caregivers at community level are being developed, as strategies are being prepared to help healthcare workers and community volunteers to work with mothers and their communities, those same misconceptions and myths are being addressed, are being discussed to basically inform, discuss, convince mothers, convince their network, which include the partner, which include the mother-in-laws and others, to ensure that the benefit of breastfeeding, which we know will outweigh all of these myths and misconceptions, are basically promoted and supported so that families, caregivers can basically make the most informed decision and also provide the best support they can.
Dr. Mwangangi, we mentioned earlier that it takes a village to support a mother to breastfeed up to 24 months. What is the role of men in all this?
Yes, so men are important when it comes to, one, of course, bringing life onto earth with their partners, but also in supporting the mother when it comes to ensuring that she's calm, she's able to be in an environment where she's able to breastfeed her child. She's able to, ensure that the tasks in the households are equally shared so that you can give enough time to the mother. And perhaps, much as, we've talked about the cultural norms and societal norms, it would be important to have this support extended in different spaces in our country. For example, having parliamentary mothers being able to actually have lactation stations in parliament and having the same extended in different workplaces. So really it takes a village, it takes a nation, and men do have a role, a pivotal role, as policymakers, as leaders, as the political class, to really support this initiative on ensuring that children are breastfed exclusively, at least for 6 months.
Carol, even as you sensitize workers to ensure they keep on breastfeeding, do you target the men too, because they are the fathers of these children?
You're right, because the messages that we've done on the policy of breastfeeding and the whole best practices for children have even been translated to vernacular, so that they are all on all radios and on TV, so that everyone can listen. So we may not just put men in a room alone But when we go into companies to speak to them, first we approach the CEO, and most of the companies, as you know, are run by the CEO, so that they call their teams together and they lead from the front. So when the employees and all the other managers see their CEOs leading this, then everyone gets interested and gets to understand why. And for us, I think for KEPSA, the most important thing is to keep encouraging businesses just get a small corner and put a lactation place, because then we can stop a lot of the young women from expressing their milk in the toilets, which is not safe. And you know, breast milk at least can stay up to 12 hours and be able to go home with it, even where they're not feeding. So those are the messages that we are targeting. And so we go into an office, and it doesn't matter who we find, whether it's the men or the women, we take the message there, we get to encourage them, we get to show them the bottom line of their own companies, if they encourage this, especially the lactation places, and even giving the women time out during work hours to be able to express their milk. And we've seen such good responses. As I mentioned earlier, you saw the first, the champions, most of them are men. When I talked about Michael Joseph, Bule, Architect Lee, Manu Chandaria, we got a lot of the men themselves, and especially the older men and the captains of industry to be the champions of this, so that other men can realize that this is important and they need to be part of that. That was actually deliberate to do that, and it's been so good to see other companies come together. So it's just not been the women, but also the men, and leading their companies and saying, we want to do this for our company, we want to set this up. And so that's been very, very encouraging. And so and that's why we started saying, let's translate our own KEPSA policy on for private sector into even vernacular, so that it can go up to the villages and to the markets. And so we hope more and more we can see this being done.
And still staying in the workplace, Nora is asking, there are some companies that are very rigid and they do not offer those amenities you talk about to support breastfeeding in the workplace. How can members or employees reach out to KEPSA so that somebody can intervene on their behalf?
So yes, so you can write to us, info@kepsa.or.ke, and someone will respond. As I said, we have a team that runs this, led by Gloria Dekay, who is the KEPSA trustee, because we do this under KEPSA Foundation. So the team under Gloria, and Gloria herself will come, and she'll be able to meet with the team, we'll meet with the employers and make them to understand. As I said, we even have numbers. You know, we're able to show you numbers of how best it works for you as an employer. If you have a lactation place, if you allow women to be able to express their milk, or time out, you know, the 3 months or the 4 months, you know, just the impact it has on your own bottom line, because sometimes some of the businesses need to see that, the economic impact, because they think that maybe this will negatively impact their organizations. But what we've realized and seen, it actually has a very positive impact, unlike organizations that do not allow this, because the women are there sometimes because you want to keep the job for the sake of your family, for the sake of your child. So you're right there, but you're really not focusing. But if this was you had this opportunity to feed your child, or be able to know that you can express your milk and take it back to your child in the evening, you focus on your work, and so there's productivity, you know. And so those are some of the things that we tell the employers. So employees would like to reach out to us, please feel free to write to us at info, and someone will get back to you, and we will talk to your organizations.
Okay, so ladies and gentlemen, definitely we're having this conversation in the face of a pandemic that has affected not only Kenya but the globe. And the question to Dr. Mwangange would be, has COVID affected breastfeeding practices?
So yes, so Gladys, sadly, we are seeing a decline in terms of attendances to hospital visits. We've seen a fair decline when it comes to antenatal care clinic visits. And most significantly is that we've seen a decline when it comes to postnatal care clinics. And why this is important is that during postnatal care services, that's when the mother gets, you know, most of the follow-up in terms of how is she doing when it comes to breastfeeding? Are there any challenges that she's facing? Is there any extra support that she requires when it comes to breastfeeding? And so, yes, indeed, COVID-19 has affected breastfeeding practices. However, as mentioned by the panelists today, we are really here today to advocate for this continued, you know, practice, to reassure mothers that it is safe to continue breastfeeding even when they're COVID-19 positive, and to ensure that this initiative continues on because of the many, many benefits that we've discussed tonight.
Professor Ndwati, even as we breastfeed within this pandemic, there are concerns coming from mothers as to the virus passing through the milk. Is this a fact or a myth?
Thank you. That's a real question and being asked everywhere. COVID SARS-2 is a respiratory infection. It's not passed through breast milk. We don't have mother-child transmission at the time of delivery or during pregnancy. It is a respiratory infection. For the mother who is COVID positive, has an infection, we advise her to use a mask, preferably an N95 mask as she's breastfeeding, to observe good hand hygiene in terms of washing her hands frequently. And the experience is that the mothers who have had this situation have been able to breastfeed successfully. A number of children have acquired COVID infection in the newborn period, but from the published studies, the infants have done well. The very newborns have recovered from the infection successfully. So breastfeeding is still the optimal method of feeding the baby whose mother has COVID infection. There's another cluster of babies who often people think that maybe this is a baby who should not be breastfed. Low birth weight infants, babies who are born preterm. Mothers are worried that the baby is not growing or is not going to grow enough. Even those infants, those low birth weight infants, even those who are born 1 kilogram in birth weight, breast milk is the optimal way of feeding that baby.
Okay, and Patrick, the impact of COVID, of course, has been the social economics, or has touched on the social economics of every single person, with some houses not even having the basic nourishment for themselves. Is this something that is affecting breastfeeding?
Well, thank you, Gladys, for the question. In fact, what we've noticed through the different surveys that were conducted by the authorities, basically Kenya, the government of Kenya, is that COVID had an impact, like it was said earlier, on attendance to services, and therefore our ability, the ability of the counties to support mothers and the communities to enforce breastfeeding. Now, what is also important to know is most of the respondents to surveys we've seen in the past few months vis-a-vis how COVID is affecting people's life is that there is a scare. People are scared about or are concerned about their ability to meet their food requirements. So there are some food insecurity concerns. Well, one of the key value add, again, in this context of breastfeeding is whatever the nutritional status of the mother, she can breastfeed. She should continue to breastfeed. So this placed the child at a very privileged situation whereby he or she should continue being breastfed. And as concerned about household ability to meet their food requirements on a daily basis, on a weekly basis, on a monthly basis continue to happen, we know that government also a strengthening program that will provide some cash assistance to families, especially the impoverished one, and to different places to ensure that food security needs are also met.
Okay, and even as we draw this conversation to a close, I'll start off with you, Professor Ndwati. How can the family unit, the community, policymakers do to help in creating a conducive environment to achieve exclusive breastfeeding and, of course, up to 24 months?
Yes, communities and families are very important. I think supporting the mother to breastfeed, passing knowledge from one generation to the other about the importance of breastfeeding, supporting your local community to have good health services, with qualified staff who you can call on when you have a problem. In workplaces, accepting women as women. Coming to the workplace as a woman with the baggage of being a mother, even a care provider, as opposed to expecting them to come to the workplace looking like a woman but performing like a man. So support for those lactation centers within the workplace. And I'd like to point out that this is a legal requirement today, that every workplace which has more than 50 workers should have a lactation center. So I think being focused, being child-centered, taking care of our future generation will actually help us to support women to breastfeed, which is a great foundation for life, and to raise children who are healthy and to conserve our human capital. When I talk to mothers, I usually tell them, you probably can guarantee your child having a college education by just ensuring that you feed them appropriately in the first 3 months, or first 3 years of life. So that's my push on this.
Okay, and Carol, what's your parting shot on the same?
The parting shot is that I think there's no reason why we shouldn't embrace the breastfeeding because the data is there to show the impact and the productivity for businesses. And that to actually give the excuse that you have a small office is not good enough, because you need a very small corner. It doesn't take much. And for anyone in the business community who would like to see a small model one, we have one in our office. So you're invited to visit us to see. If you'd like any materials, please go to our website. We have the policy for private sector. We have the policy for government. We have all everything that you need. We can skill you to be able to do this.
Okay, and UNICEF, definitely a great champion for breastfeeding. Patrick, your parting shot.
Thank you. In short, one message is we know breastfeeding, exclusive breastfeeding for the first 6 months, continued breastfeeding for the first year, the second year, in addition to complementary feeding from 6 months of age, work. We know what we lose by not breastfeeding. We know what we lose at the child level, at the community level, but at the country level in terms of the economy. So all efforts should continue to be around promoting, supporting breastfeeding for all children in Kenya in all time.
Dr. Mwangangi, we are doing well as a country. What more can be done to ensure that we get to 100% breastfeeding for all mothers?
Great. So resourcing, advocacy and promotion of breastfeeding is quite important. And I recently came across a study that tells us that for every $1 that we invest in promotion for breastfeeding, we actually get $13 in return, and that's astounding, and really makes a case for investments in advocacy. A platform like today, where yourselves as Nation Media Group have really helped champion the message for breastfeeding. And so the government remains committed to this. The government remains committed to the different initiatives that are underway. And we would like to continue partnering and, of course, adopt a whole of society approach to this. Like you said, Gladys, it takes a village, and so everyone has a part to play.
Thank you, Dr. Maasai Mara, who is the Chief Administrative Secretary at the Ministry of Health. We are also joined by Patrick Courier, who is the Head of Nutrition, UNICEF Kenya, Professor Ruth Nduwati, who is a pediatrician and, of course, who practices at the University of Nairobi, Carol Karoga, who is the CEO of the Kenya Private Sector Alliance. Thank you all for joining me on this very, very imperative and critical conversation. We hope all the conversations are all the nuggets we have shared today will be implemented so that we can support all mothers to breastfeed right from the get-go up to 24 months. It is the Nation Leadership Forum focusing on breastfeeding and to support a healthy planet. My name is Gladys Gashanja. Thank you for your time. Stay with NTV as NTV Tonight is coming your way, hosted by Zainab Ismail.
sensitivity pain fast with Sensodyne Rapid Action for clinically proven relief in 60 seconds.
Breaking news from Molfix. Let's see what they're developing right now.
Invention from Molfix just for your baby. Molfix pants with anatomic fit technology. New Molfix pants, an invention from babies for babies.
You should also try Molfix.
Members of the public are notified that various institutions have reported over 800 million units of unclaimed shares among other assets to the unclaimed finance.
9.9%